moment you see, yeah, yeah.
All right. So good and welcome to Mohanty. Today's the art of case taking, and while it is a noggin topic in our practitioners, and also it covers both allopathic as well as homeopathic subjects. So it is relevant. It doesn't matter what system of medicine you belong to. It covers all the systems because it is so important uh, as a doctor for you to be able to take the case properly and to assess the patient. So the reason we call it the art of case taking is because there's a lot of skill required, a lot of practice. It's not just a format that we are by hearting and reproducing in the clinic. And today we have Sujata to help us go through the various aspects of case taking, which is both an art and a science. Okay, Sujata, take it over from you.
Ma'am, should I start? Ma'am, should I start now? Okay, ma'am.
Start.
Okay,
Yeah.
ma'am. A very good evening to everyone. And so, first of all, thank you so much, Karthik sir, for giving me this opportunity, and Diksha ma'am for guiding me through all this. So, जैसे आप सबको अभी स्क्रीन पे दिख रहा होगा that today's topic is about the art of case taking. So, like we all call that homeopathy is a science and art. So, that artistic way हमें case taking पे apply करना है. So, it's the first step in the process of cure. एंड केस टेकिंग ऐसा नहीं है कि हम थियोरिटिकली इसको डिस्कस कर देंगे तो इससे नॉलेज गेन हो जाएगा. इसके लिए आपको प्रैक्टिकल एक्सपीरियंस की जरूरत है, लेकिन मैं यहाँ पे थियोरिटिकल एस्पेक्ट के बारे में डिस्कस करूंगी. सो लेट्स स्टार्ट फॉर टुडेज टॉपिक. सो फर्स्ट ऑफ ऑल, व्हाट इज अ केस? So case is not merely combination of symptoms. हम केस को ऐसे नहीं समझ सकते that it's just a combination of symptoms, but an instance of disease, an event, and a change in the whole person from his original state of health to his present state of sickness. Like we all know that state of health में जब vital force drains होता है तभी state of sickness आता है. So it's a developmental process. So we have to know that case is not just a combination of symptoms. It is a process. It is a developmental history. Like the present patient's state of health changed to state of sickness. So it is a totality of alteration. जो alterations या फिर जो derangements हुई है उन सब की totality है एक case. So it comprises of all expressions on mental, physical plane and on parts which logically form a portrait of the disease. So like we know that अगर हमें mathematically draw picture के बारे में समझना है तो we always take the constituents the mental symptoms, physical generals and modalities, particulars, concomitants. ये सब हम टोटलिटी मिलाकर एक ड्राफ्ट पिक्चर बनाते हैं. तो वैसे ही डिजीज पिक्चर और पोर्ट्रेट ऑफ डिजीज के लिए वी हैव टू टेक all the mental symptoms, physical symptoms, and on particular symptoms as well. So that is the case. So now the definition of case taking, a simple definition of case taking. So case taking is a unique art of receiving information from a patient as well as from attendants to define the patient as a person and diagnose the disease. So case taking is a unique art. So it is the artistic process. So it is a unique art of receiving information from patient. Patient से हमें information collect करना है. So this is the artistic process. इतना skill होना चाहिए कि patient हमें अपना सारा problems details में बता सके. So that is why it is a unique art of receiving information from a patient as well as from his attendees to define a पेशेंट एज ए पर्सन लाइक वो हेल्दी कंडीशन में कैसा था एंड उसकी डिजीज अभी जो सिकनेस कंडीशन है उसकी बिहेवियर कैसा है तो वो अटेंडेंस से पता चलेगी एंड डायग्नोज द डिजीज. So what is homeopathic case taking? So homeopathic case taking unique कैसे है? So it is the artistic process. So case taking is basically the artistic process of ascertaining. Ascertaining means to find out. हमें find out करना है what is the cause and what is the developmental history. So ascertaining and understanding. So am I audible now, ma'am? Okay. So homeopathic case taking, it is an artistic process of ascertaining. Ascertaining means to find out what is the reason behind this sickness and understanding it. That developmental history case
Yeah,
of patient.
you're audible. Just
I'm clear. Mhm.
what
I'm
happened?
now
Hello?
audible.
No settings are. Yeah, you're audible. That was some other attendee who was having trouble. It's clear. You can carry on.
Ma'am, now audible clear. Okay, ma'am. Okay.
You can
So homeopathic case
talk.
taking is the artistic
You
process of
can talk
ascertaining,
a little
understanding,
louder.
and
It's
recording.
okay. You're clear.
Okay, ma'am. Okay, okay. Case taking is the artistic process of ascertaining, understanding, and recording the complaint of patient in such a way. उसको उस वे में हमें कलेक्ट करना है symptoms that based on that totality of symptoms जो हम collect करेंगे totality of symptoms based on that we can manage the case and prescribe the homeopathic remedy on the basis of anamnesis. Anamnesis means the developmental history. Patient की जो health condition से sickness condition तक जो changes आए हैं तो दैट इज द डेवलपमेंटल हिस्ट्री. हमें उसको कलेक्ट करना है एंड उसके बेसिस पे हमें होम्योपैथिक रेमेडी चूज करना है एंड ट्राइज टू क्योर द केस. So basically, homeopathic case taking differentiate from others on the basis of individualistic approach. So the most important thing about case taking, homeopathic case taking, is the individualistic approach. So, like Elizabeth Wright says that every time you take a case, you are entering into a new world. So, हमें each patient को as individual समझना है. एक case को each case को हमें individualistic approach के जरिए समझना है. So that is the important thing about homeopathic case taking. So every time you take a case, you are entering into a new world. Okay. So what is this individualistic approach? So what is this individualistic approach? Like Hahnemann says, like we all know that in homeopathy, we believe that there are no diseases, only sick individuals. That individual is suffering, his vital force is deranged, and that will produce the suffering, that will make that person suffer. So that's why there are no diseases, only sick individuals. And homeopathy strongly believes that the patient as a person suffering and not his anatomical organs. Like here applies the theory of vital force, that vital force deranged होता है तभी patient suffer होता है. So each patient की vital force वो individual होता है. So it will individualize the person. So we have to take the individualistic approach in every case. More concentration, we have to put more concentration on constitutional symptoms, miasmatic symptoms, strange, peculiar, rare and characteristic symptoms than on the pathological symptoms. हमें पता है क्या क्या होगी. लेकिन जो peculiar, rare, strange symptoms है, जो symptoms एक person को बाकी person से differentiate करती है, that will differentiate from that person from everyone. So that we should put more concentration on those symptoms. Those are the constitutional, miasmatic, strange, peculiar, rare, and characteristic symptoms. So that is the individualistic approach. Like I discussed that pathological symptoms से ज़्यादा हमें constitutional and miasmatic symptoms में ज़्यादा importance concentration देनी है. लेकिन what is the importance of diagnosis? फिर वो pathological symptoms या फिर वो diagnosis का importance क्या है in homeopathic case taking? So अगर हमें पता होगा that जो डिजीज हम पढ़ते हैं लाइक प्रैक्टिस ऑफ मेडिसिन, गायनेकोलॉजी, सर्जरी, ऑब्स्टेट्रिक्स, इनमें जो हम डिजीज के बारे में पढ़ते हैं, अगर वो डिजीज हमें पता होगा तब हमें पता चलेगा दैट दिस डिजीज और दिस केस इज curable or it is incurable or it is just a simple indisposition or it needs surgical diagnosis या फिर सर्जिकल ट्रीटमेंट इसको चाहिए वरना पेशेंट की लाइफ को थ्रेट है. तो वो पता कैसे चलेगा अगर हमें डायग्नोसिस के ऊपर नॉलेज होगा. सो दैट इज द इम्पोर्टेंस ऑफ डायग्नोसिस इन केस टेकिंग. होम्योपैथिक केस टेकिंग हमें रेमेडी सिलेक्शन में वो डायग्नोसिस हेल्प नहीं करेगी, लेकिन हमें केस टेकिंग कैसे करना है या फिर केस को मैनेज कैसे करना है उसके लिए इम्पोर्टेंस ऑफ डायग्नोसिस है एंड हमारे नॉलेज के लिए वो इम्पोर्टेंस है. So it will help in safer management of the case, helps us to differentiate between whether it is a curable disease or it disease of the case, helps in advising proper diet. So एक diet अगर indisposition एक simple indisposition है तो हमें पता चलेगा that it's a simple indisposition हम and we can recommend them a proper diet or regimen and और कुछ मैनेजमेंट के लिए होगा तो. So that's why importance of diagnosis in that is the importance of diagnosis in homeopathic case taking. Okay. So now objective और aim of case taking. So case taking करने का हमारा main aim क्या होना चाहिए? तो what are the objectives or aim of case taking? So first of all, we discussed that it is an individual. So first aim would be to understand the patient as a whole. हमें patient को as a whole समझना है. वो physical generals क्या है, उसकी habits क्या है, उसकी sleeping habits क्या है, desires, aversions, उसकी mental characters क्या है, जो strange, peculiar characters, to understand the patient as a whole. And second thing is to understand the surroundings of the patient and his reaction to it. तो पेशेंट की सराउंडिंग्स लाइक चेंज ऑफ वेदर पे उसकी रिएक्शन क्या होती है, या फिर ज्यादा कोल्ड वेदर में उसकी रिएक्शन क्या होती है, या फिर इन समर वेदर रिएक्शन क्या होती है. सो those are the things the aim of case taking, to understand the surroundings of patient and his reaction to it. Then finding the totality of symptoms. तो हमें totality of symptoms तो मतलब निकालना ही है. Finding the totality of symptoms to give him a pocket remedy for finding the nature of the disease, like whether it is a curable case or it is an incurable case or acute है, chronic है, or it's just a simple indisposition and we can cure it by changes in diet and regimen. So the aim of case taking would be finding out the nature of disease as well. Then finding the causative factor. What are the cause behind that condition? So in acute disease, there is always an exciting cause. In chronic disease, there is a fundamental cause. And in false chronic disease, like the pseudo-chronic disease or iatrogenic chronic disease, those are due to a long-term allopathic medicines, that is the maintaining cause, then finding the development of symptoms, like उसकी state of health से sickness तक आने में जो development symptoms क्या क्या आई है, क्या क्या disappear हुआ है, या फिर क्या नए symptoms develop हुए हैं, so finding the developmental history of the symptoms and keep a systemic record. Always keep a system record that will help us to observe the direction of cure. Like we know that Hering's law of cure. So cure की direction क्या है, that case cure हो रहा है या फिर कुछ अलग direction में जा रहा है. So we have to keep a systemic record for that. Then predict the prognosis of the case, like ये cure, this is an incurable case and we can just palliate and give patient to patient a temporary relief, and helps in trinity of diagnosis, that is CMD, that is constitutional diagnosis, miasmatic diagnosis, and disease history. And it also, the aim of case taking would be to select the proper homeopathic remedy. That is the main aim, to select a proper homeopathic remedy for that case and cure the patient or cure the case. Then, like Hahnemann says, that when the picture of the disease is once accurately sketched, the most difficult part of the task is accomplished. So, picture of the disease cases sketched होगा based on his physical generals, mental generals, particular symptoms. ये सब collect होने के बाद will take a picture of the disease, so that we can compare it to macromedical drug pictures and select a proper medicine, proper remedy for that case. So that is the most difficult part of the task, that is the case taking is accomplished after sketching a proper sketch of the disease. So, so during case taking, the physician should be, so case taking करते time the physician should be, physician कैसा होना चाहिए? Okay, कुछ qualities होनी चाहिए physician की. So first we all know that free from prejudice, that is unprejudiced observer. So first thing is that free from prejudice, always be a unprejudiced observer, and sound senses or alertness, उसकी सारे senses alert पे होने चाहिए, that patient की behavior कैसा है, वो कैसे चल के आ रहा है, या फिर वो कैसे उसकी hand movement कैसे है, वो क्या बोल रहा है, सारे senses physician की alert stage पर होनी चाहिए. Correct and complete observation of facts and phenomenon. हमें facts and phenomenon की correct and complete observation, completely उसको observe करना चाहिए. ऐसा नहीं कि एक बार देख लो and बोल दो that हाँ ये इससे suffer कर रहा है. ऐसा नहीं, हमें correct completely observe करना है as an unprejudiced observer about every fact and phenomenon. And then the fidelity or faithfulness to homeopathic principles. So I think that this is the most important thing to become in any physician, be it a allopathic or homeopathic, to trust your homeopathic principles, because अगर हमें हमारे principles के ऊपर trust नहीं होगा, then why would the patient trust us कि हम उसकी केस को क्योर कर ले? हमें अपने पर एंड होम्योपैथिक प्रिंसिपल्स, अपने सिस्टम्स के प्रिंसिपल्स की थ्योरीज पर एक ट्रस्ट आना बहुत जरूरी है, एंड इट इज द मोस्ट इम्पोर्टेंट थिंग टू बी ए सक्सेसफुल होम्योपैथिक प्रैक्टिशनर. Then properly recording the facts without omission. ऐसा नहीं कि पेशेंट कुछ बोल रहा है एंड ये इम्पोर्टेंट नहीं है, ऐसा नहीं है, बिकॉज वी नेवर नो दैट वही एक सिम्टम्स हमें उस केस को अनलॉक कर सकती है एंड रेमेडी चूज करने में हेल्प कर सकती है. सो दैट्स व्हाई वी हैव टू राइट एवरी सिम्टम without omission, and skillful in developing a fruitful rapport with the patient. Rapport means communication. This is the art and this is the skill every physician should have, that to create a bonding, a understanding between his with his patient, so that patient will trust him and उसकी सारी problems discuss करेगा तभी. So that is the skill of every physician. We have to develop a fruitful rapport with the patient, एक communication, एक understanding हमें बनाना चाहिए, and must be a good human being. to understand the patient as a whole and have knowledge about pathology. Knowledge about pathology will help us to know whether this case is curable or not, or it is just indisposition. So everything we will know about if we have the knowledge about pathology, so that we know that what type of disease this is or the nature of the disease. So this is many ye books, but that's why I just put it here so that it will help you all that clinic setup like ये क्लिनिक बनाने के बाद एंड प्रैक्टिस करने के बाद नॉलेज होगा बट आई जस्ट फाउंड इट फ्रॉम बुक सो आई पुट इट हियर that waiting room with sitting facilities and proper ventilation with some help and consultation by appointment because irritable patients बहुत जल्दी irritate हो जाते हैं because homeopathic case taking में हमें at least 30 minutes से ज़्यादा टाइम तो लग ही जाता है so consultation by appointment is a good option and privacy should be always maintained in consultation room so that patient को आप पे trust होगा and वो मतलब उसको लगेगा that हाँ privacy maintain होगी तो वो trust करके आपको अपनी सारी problems बता पाएगा and greet the patient with a comfortable warm wish and proper sitting चाहे आपका दिन कितना भी बुरा गया हो लेकिन वी हैव टू गिव ए वार्म विश एंड उसको कंफर्टेबल बनाना है एंड होता है ना ऐसा हम सुनते हैं दैट कुछ पेशेंट्स ऐसे होते हैं उनकी आधी मतलब 50% डिजीज क्लियर हो जाती है डॉक्टर को देख के या फिर डॉक्टर से बात करके सो वी हैव टू बी दैट ह्यूमन बीइंग फॉर आवर पेशेंट्स सो दैट इज इट देन then Hanniman's direction to unlock the case. केस को हमें कैसे केस टेकिंग करनी है एंड क्या क्या डायरेक्शंस हमें फॉलो करना है टू केस द प्रॉपर पिक्चर ऑफ दैट डिजीज और दैट केस टू अनलॉक द केस सो द डूज और व्हाट कैन बी डन तो हमें क्या करना चाहिए so the like we discussed that it is an individualistic approach so most important thing is individualistic study like we are dealing with a human being not a pathological specimen so we have to consider every patient as an individual and every case as an individual case so all then always leave the patient at freedom हमेशा पेशेंट को फ्रीडम दो ताकि वो फ्लो में जो भी बोल रहा है उसकी प्रॉब्लम्स वो अच्छे से बता सके सो ऑलवेज लीव द पेशेंट एट फ्रीडम लिसन टू द पेशेंट केयरफुली अच्छे से सुनो कि वो क्या बोल रहा है उसको फ्रीडम दो वो अपने फ्लो में बोलेगा कि ये सिम्टम्स है या फिर दीज आर माय प्रॉब्लम्स एंड लिसन टू द पेशेंट केयरफुली सो फर्स्ट रिक्वेस्ट द पेशेंट टू टॉक स्लोली सो दैट यू कैन मेक इट नोट क्लियरली so पहले उनको बोल दो that to talk slowly so that we can make a note every symptoms and then listen to the patient carefully do not interrupt so symptoms हमें तीन sources से तीन main sources से ही मिलेगी first is from patient's complaint बोलता है and the second thing is about is from attendance report attendance क्या बोलेंगी about patient को health condition में ऐसा था and disease condition में ऐसा हो गया है so we will get from those symptoms from attendance side and third and the most important thing is the source is physician's own observations so that is the most important thing because patient and attendance symptoms को ज्यादा बड़ा चढ़ा के बोल सकते हैं या फिर थोड़ा कम करके बोल सकते हैं लेकिन physician's own observation will be unaltered so that is the most important source then note down every by the patient in detail and his own very expressions so patient जैसे बोल रहा है हमें सिम्टम्स को उनकी लैंग्वेज में इजी लैंग्वेज में जो जैसा बोल रहा है उसकी सीक्वेंस में उसकी लैंग्वेज में हमें लिखना है एंड लीव स्पेस बिटवीन ईच सिम्टम begin a fresh line for each symptom so that we can like patient बोल रहा है that I'm having headache फिर उसके बाद उसने हेडेक के बारे में डिटेल्स नहीं बोला लेकिन हमें बाद में हम उससे क्वेश्चन कर सकते हैं लेकिन तब हम इंटरप्ट नहीं कर सकते so that's why leave space between each symptom and begin a fresh line for each symptom so that we can complete it last को हम क्वेश्चन उसके कंप्लीट कर सकते हैं Then try to collect much info about each individual symptom, like its onset, its location, its sensation, its concomitants, its modalities. So उसको हम बाद में क्वेश्चन करके कंप्लीट कर सकते हैं इफ पेशेंट अगर कंप्लीटली ना बोले तो. then then after collecting the data, read it out to the patient as a method of confirmation. If the collected data is sufficient, is insufficient, then ask some questions. Then we have the permission to ask some questions to complete each individual symptom. The simple and easily understandable questions, always simple and patient की language में होनी चाहिए, जिस language में patient को comfortable लगेगा बोलने के लिए. The language he will understand, and that will be simple for a patient. Then always focus to get more rare, peculiar, and strange symptoms, because homeopathic case taking, we all discussed that it is an individualistic approach. So always we have to focus to get more rare and peculiar strains will individualize the person from others. Then study the patient spiritually, emotionally, mentally, socially, and physically. Then give attention to the physician's personal, patient's personal details. So physician should always give attention to the patient personal details, like his habits, his sleeping habits, his desires, his occupation, like वो कौन से environment में काम कर रहा है, वो सारे हमें collect करना है. Patient personal history, because maybe those will be the obstacles to cure. Then always give importance to your own observation than told by patient and attendants. Like I told in previous slides that patient and attendants symptoms को थोड़ा exaggerate करके बोल सकते हैं या फिर थोड़ा कम करके बोल सकते हैं, लेकिन physician's own observation matters the most because वो unaltered होगा. So that's why. And collect the treatment and medicinal history if patient coming from other physician या फिर कोई treatment ले रहा था कुछ भी condition के लिए, so always those treatment and medicinal history. And in female patients, always take the gynecological and obstetrical history. Like in gynecological, about the menstruation, menarche, if already the menopause happened, then about the menopause and the menstrual flow, regularity of periods, and obstetrical history about the कितने child है या फिर about the abortion अगर कभी हुआ है, तो always take in female patient always take the gynecological and obstetrical history. So in comatose patients, infants, and unconscious patients, we can rely on the symptoms told by the attendings like parents, friends, etc. Comatose patients, infants, and unconscious patients. Always be alert for hypochondriac and hypersensitive patients because they will exaggerate the symptoms. So they are only the physician's own observation will help to unlock the case. First, try to treat acute attacks and symptoms related to it. And friendly approach is the key to success in homeopathic practice. Like it is the skill to create a rapport, to maintain a understanding communication between your patients. That is the doctor-patient relationship. So we have to have that friendly approach in our practice. Always maintain a record of symptoms for future reference. That will help us to observe that what is the direction of cure. Then try to collect all the symptoms patient is having. जितने symptoms हम collect करेंगे medicine choose करने में it will help. Drop picture comparison में वो help करेगा. So that's why try to collect all the symptoms from patient, his attendants, his own observations. So then based on that, we can compare those with Macramedica and choose the most simillimum for that case. So if so that more symptoms will help us to select better selection of a simillimum for that case. So then these rules are the what we can do. And then let's discuss about the don'ts or what we shouldn't do. हमें क्या नहीं करना चाहिए. So first thing, avoid tense atmosphere because अगर हम टेंस होंगे या फिर एटमोसफियर वैसा होगा तो पेशेंट को ट्रस्ट नहीं आएगा कि ये मुझे ठीक कर पाएगा या नहीं. So that's why avoid the tense atmosphere. Try to cut down the waiting time or go for consultation by appointment. Avoid using technical or medical words because patient is a common man and he will not familiar with the technical medical words like we all use. So do not so avoid using those words. Do not get emotionally involved with patient because अगर patient रो के कुछ बोल रहा है तो हमें उसके साथ रोना नहीं है. So do not get emotionally involved with the patient. Then do not interrupt. अगर वो फ्लो में बता रहा है हमें बस लिखना है उसको बोलना है अब slowly बोलो. We will write those symptoms, but do not interrupt. Don't ask any leading questions like whose answer will be either yes or no. Like हम उसको पूछेंगे that आपको headache के टाइम पे भूख लगता है कि नहीं या फिर इस टाइम में आपको headache होता है कि नहीं. So don't ask any leading questions because वो आपको डिटेल्स नहीं बताएगा, सिर्फ ये और नो बोल देगा and that will that's where we will become the pressurized observer. So don't ask any leading questions. Leading question answer of which will be either yes or no. You cannot totally rely upon the patient because hypersensitive and hypochondriac patients exaggerate the symptoms. So we cannot totally rely upon the patient. We should take symptoms from attendance and also from our own observations. Then no double barrel questions like example when does like अगर patient बोलेगा I am having headache, so when does your headache increase, does it by bending forward or backward, relation between headache and menstrual flow. तब वो सोचेगा मुझे किस क्वेश्चन का आंसर देना है क्या बोलना है. So don't do this. Do not interrupt and don't ask any leading questions. Also don't ask any double barrel questions like this. And do not record the symptoms abruptly. Always go in a chronological order so you can observe the direction of cure. पेशेंट आपको बता रहा है कि पहले मुझे ये सिम्टम्स आए फिर अच्छे से क्रोनोलॉजिकल ऑर्डर में लिखना है ताकि हमें मेडिसिन सिलेक्शन में भी हेल्प हो एंड फिर फॉलोअप के टाइम ऑब्जर्वेशन ऑफ डायरेक्शन ऑफ क्योर के टाइम भी हेल्प हो. And then do not prescribe unless you are sure about the remedy, especially in chronic case. Instead, prescribe a placebo. There is no case-taking format. There is no case-taking format recommended by Hahnemann. The physician, according to his or her convenience, can design the format. Only keep in mind the aim of case taking, like we discussed previously about the aim of case taking, to understand the patient's suffering and to select a proper remedy. Like our aim to restore the to cure, as it is termed, restore the patient's state of health. So in the first aphorism, so उसको हमें दिमाग में रखना है. That is the aim of case taking, to understand the patient's suffering and select a proper remedy. According to that, we can will be applicable to this particular case. Then how to perceive true picture of a disease. Like कभी-कभी ऐसा होता है that patient बहुत सारे ट्रीटमेंट लेने के बाद हमारे पास आता है, तब हमें पता नहीं लाइक वो मेडिसिन की सिम्टम्स है या फिर ट्रू डिजीज की सिम्टम्स है. तो तब हमें कैसे पता चलेगा व्हाट इज द ट्रू पिक्चर ऑफ ए डिजीज. देयर इज टू वेज. टेक दोज सिम्टम्स बिफोर एनी ट्रीटमेंट. पेशेंट ट्रीटमेंट लेने से पहले उसका जो सिम्टम्स है that is the true picture of a disease, or discontinue the treatment for several days. सारे medications हमें several days के लिए discontinue कर देनी है. Then take the remaining symptoms. That will be the picture or true picture of that is the disease symptoms, true natural disease symptoms. Then case taking in acute diseases. So less inquiry to be done because patient easily remembers like एक दो दिन हुआ होगा सफरिंग का या फिर आज ही स्टार्ट हुआ होगा. दैट इज एक्यूट केसेस. So less inquiry to be done because the patient easily remembers every minute detail and can recall those symptoms. So less time required in acute case taking for tracing the exciting cause and the true picture of the disease. Then case taking in epidemic and sporadic diseases. So we should consider every epidemic disease as a new one and unknown one. हमें उसके बारे में वो new है, हमें उसके बारे में कुछ नहीं पता, हमें वहाँ पे भी unprejudiced observer बनना है. We have to consider every epidemic disease as a new one and unknown one. So investigation should be made in several patients of different constitutions in order to obtain the characteristic portrait of epidemic or sporadic diseases. Like we all know that drug proving में drug different constitutions पे prove होते हैं, तब हमें एक clear drug picture, perfect drug picture मिलता है. So वैसे ही we have to investigate several patients of different constitutions to know what is the true portrait of that epidemic, that particular epidemic, which is for us is the new one and the unknown one. And after collecting the group totality, removes the general symptoms. जो हमें पता है that इससे common flu में ये सारे symptoms होते हैं, so just remove those symptoms and based on peculiar and uncommon symptoms, जो differentiate करेगा इसको बाकी सारे disease से, take those symptoms and the selection of specific remedy to that particular epidemic is made. That is we call genus epidemicus for that particular epidemic disease. So genus epidemicus क्या है? That we all know that it is the remedy selected homeopathically to those diseases in which several people have similar sufferings from the same cause. It can be used as both curative and preventive against that particular epidemic only. सिर्फ वही epidemic के लिए उस genus epidemicus को हम both curative and preventive use कर सकते हैं for that particular epidemic only. Then case taking in chronic diseases. So in chronic diseases, it takes lot of time and patience to inquiry because patient cannot recall exact time, exact cause, क्या क्या development symptoms पहले आया, फिर उसके बाद मैंने ये खाया था या फिर उसके बाद ये हुआ. क्योंकि chronic diseases like for 2 years, 5 years ऐसा होता है तो patient को exact cause, exact date of origin of his sickness, of his condition इसको अच्छे से recall नहीं होता है. So it will take lot of time and patience to inquiry the chronic cases and have to take every details of his personal history, his family history, his treatment history. So we have to take from every aspect. We have to take every symptoms from every aspect. Then careful attention to every minute detail. Follow all the procedures of case taking carefully, like I discussed about the what can be done and what we shouldn't do. So we have to follow those procedures mostly on chronic case taking. So follow all the procedures of case taking carefully. Investigation should be made for the symptoms of SORA. Like we all know that SORA is the fundamental cause of every chronic disease. So after case taking, we have to investigate what is that maintaining or what is that fundamental cause जो कि chronic disease कुछ time के लिए ठीक हो जाता है फिर वापस आता है. इसकी chronic nature के लिए what is the fundamental cause? What is this SORA? So next duty after case taking. Case taking के बाद case taking हो गया, disease picture portrait हो गए, फिर उसके बाद क्या duty होता है? First thing like I discussed about investigation of SORA. Then the second thing is that pick up the characteristic symptoms. Like general symptoms तो सारे cases में कुछ same आ जाते हैं, लेकिन जो symptoms strange, peculiar होते हैं, that will differentiate that patient from others. Take those characteristic symptoms for that of that case and select the homeopathic remedy for that case based on those characteristic symptoms. Then observe the direction of cure. Direction of cure कहाँ जा रहा है? That is the Hering's law of direction of cure. Hering's law of cure. So then when patient comes second time, हमें क्या कौन सी चीजें रिकॉर्ड करना है. First thing, take those record those symptoms which are still existing, or if any new symptoms appeared, अगर कुछ नया symptoms appear हुआ है, and strike out those symptoms which are removed. जो already remove हो गया, we have to remove those symptoms, and then we'll consider about which symptoms are remaining and if any new symptoms are appeared or not. Then a fresh examination of the patient should be done, and then medicine, either the same one in higher potency or in the same potency or a different one, to be prescribed on the basis of new totality of case. फिर हमें new totality लेना है, क्योंकि कुछ symptoms disappear हो गए होंगे and कुछ नए appear हुए होंगे या फिर कुछ remaining रह गए होंगे. So we have to every follow up we have to um, uh, do a fresh examination and then prescribe on the new totality of the case. Then record keeping. So record keeping क्या है? So like we discussed that homeopathic case taking is an individualistic approach. So it is the individual examination of the patient. So noting down all minute symptoms of the patient is mandatory. That will differentiate that patient from others, like his mental generals, his physical generals, his modalities. So, and no human brain can remember or recall all the symptoms of each patient for a long period of time. So it is mandatory to maintain a record, especially in chronic cases, because those procedures lengthy and बहुत सारे symptoms इसमें आते हैं, so we cannot remember each symptom of each patient for a long period of time. So record keeping is mandatory, especially in chronic cases. Then that record or the clinical record must contain at least the following things, that is the preliminary data, that is his name, age, sex, occupation, etc., and symptoms collected from patients, attendees, and physicians' own observations, and patient's personal history, family history, treatment history. Then clinical and laboratory findings to for our knowledge, because is important. Diagnosis and clinical laboratory findings are important for our knowledge to decide whether it is a curable case or incurable case, or we can refer it to any other physician, or if this case needs surgical aid. So that's why clinical and laboratory findings are important for our knowledge. And then analysis and evaluation of symptoms. Then first prescription and general management, then the follow-up. Then why record keeping is important in homeopathy. So it helps in trinity of diagnosis, that is the CMD, constitutional diagnosis, mathematic diagnosis, and disease diagnosis. And it will help in selection of remedy, and the case always remain fresh as narrated by the patient. अगर हम record maintain करेंगे, so that case, that those symptoms will always remain fresh as narrated by the patient. Then evaluation and analysis of the case. It will help in follow-up of the case. It will help in predicting the future course of the disease, and it will help in observing the direction of cure. ये क्योर की डायरेक्शन में जा रहा है या फिर कुछ प्रॉब्लम है, so it will help us to observe the direction of cure. Then the recorded case can be easily communicated to the other medical fraternity for second opinion. So case will remain always fresh as narrated by the patient. So we can, if required, we can discuss it with other medical fraternity, and that recorded case, that the clinical record will be the will help in the communication for that case with other medical fraternity. Work as the evidence, like we always so many cases are there which is cured by homeopathy, लेकिन कुछ society में believe नहीं होते that these are cured by homeopathy. So for that evidence we have to maintain a record, and helps in research oriented work. It will help in research-oriented work in future. Then case sheet format. So there is no fixed format for case taking. Like Haniman recommended no fixed format. He mentioned that based on his own requirements, the physician can adopt a method which will perfectly suit that particular case or that condition. For example, in refer to Organon of Medicine book by Abdul Kumar Das, that has 3 volumes. So volume 2 has in chapter 37 there is a example format for cases, and also there is in Nagendra Babu book there is also in page number 330 there is a example format case format. So that will help to know how we can what is the actual case format should be. So So that's all I want to discuss about case taking. Like मुझे अभी तक जितना पता है.
Okay. Yeah. Thank you, Sujata, for the extensive explanation on case taking. I think can you hold on for a second, please? Just give me a second. I'll be back.
Okay, ma'am. Okay. So if you have all having any questions regarding case taking, you can ask regarding today's topic so that we can answer it better.
Yeah. Sorry, I'm back. So thank you for that extensive explanation. Most of the time in case taking, we like to take the references from several authors, both allopathic as well as homeopathic. So, like Sujata says, there's no one particular no one particular author that we refer to. We have to use our common sense and our observation to pick up the best format and use it in our future practice. So, if there's nothing, we can move on to the question answer session. And I request you all to, I think some of you have written questions way back when the session started. So, if you don't mind, can you type again, please? For those of you who wrote questions right at the beginning. I'll deal with all the questions one by one. Okay, so there are some here in the Q&A section. Let me see which is the first one. How to select
Yeah,
remedy after totality symptoms? Yeah, so that's the first question. Uh, so it's a very general question when you ask that how to select the remedy. Okay, also before I speak, please let me know if my voice is not clear or it's not audible. Let me know clearly in the chat box down there. How to select the remedy? So getting a totality of symptoms itself is not an easy job because you have to choose the correct symptoms. You have to choose the relevant symptoms. Sometimes you may not get the complete picture. Sometimes you may not get the kind of picture that you are hoping for. If it's an acute case or if it is a very small case, if they come for a very short complaint. So in that, you have to choose the remedy that comes to mind. There is no specific do and don't in that. There is no right and wrong answer in that. It is whatever that comes to your mind which suits. And in case taking, many times we give a medicine for the moment and call the patient back. So sometimes if the medicine does not satisfy your totality or doesn't satisfy your concept of similimum, you can call them back, and by then in that time you can analyze and you can evaluate and find a better remedy that suits the case. So how do you select the remedy? One is through repertory, which is again a process. It's a specific process. Another thing is just your knowledge of materia medica itself. So many times when you take a case, you get 4 5 remedies in your mind. Ha, this can be belladonna. Okay, this can be calcarea cub. So when you get that idea in your head, usually you should listen to that because many times it works. Many times it's right. Many times it treats at least 60 to 70% of the case in the first sitting itself. So it's a very gentle to whatever instinct that you have in your head, whichever remedy comes to your mind. Most of the time it works. Next question. What kind of thing to know during chronic cases? I think Sujata covered that in her later slides. This question must have come right at the beginning. So she has said in chronic cases, you have to deal with the duration, the extent of the disease, the intensity of symptoms, myism. So these are the things for you to analyze as a physician when you're taking the case. And also give a lot of importance to history, family history, past history, personal history, because all these things have contributed to the chronicity of the case itself. Next one. Can we take a case for acute diseases also? Yes, you can. Why not? Because when a patient comes to you, you'd like them to be continue being your patient, isn't it? It's not just they'll come the one time, you treat them and they're gone. You want them to keep coming back to you. So for that, it's good if you can keep records of the patient. Record doesn't only mean their contact details and their age and gender and all that. It's also to do with their past history, their family history. And to tell you the truth, from a clinical point of view, all patients like to tell details about themselves. They like to be questioned. They like the doctor to give them attention. So it's good if you can take down a short case. Don't spend too much of time but asking too much of history, or, what you did, बचपन में क्या किया और कौन से स्कूल में आप पढ़े थे. Don't bother with all that. Just ask about complaints and what is relevant for that particular complaint. And it's good to have the record of the patient. Suppose they return next time with another complaint. So it's good to have a case for acute diseases also. Okay. What else? What's the next question? The chat box. मैम ल्यूकोडर्मा के केस में कैसे मोडालिटीज कैसे लेंगे? Leukodema. So, I mean, sometimes you don't have to ask very specifically the modalities. If it is a very clear modality, the patient themselves will come and say that, it is worse during the summer, गर्मी के time पे ज़्यादा बढ़ता है या ठंडी के time पे मुझे बहुत problem होती है. So when the patient themselves tell you, you can pay attention and note it down. But then something like leukoderma, what happens is it takes a while for you to treat such a case, such a condition. So you have to give it the time, and you have to be patient and ask the patient also to be patient, that you cannot expect treatment or cure immediately. It is unfortunately a progressive disease, so they will usually not be modalities in leukoderma, but if there is, just note it down. But your approach should be more to make the patient feel comfortable. It's more of a social stigma. They think that all these patches and all these pigmentations are all, people will think it's disease. Even psoriasis is not contagious, but many people think that it is. When they look at it, they think that it spreads. So your job is to comfort the patient, and your job is to tell them that, look, be patient, and also be confident that it's not going to spread and it's not going to make you ugly. No specific modalities in leukoderma. It's just that in case they have any other concomitants, or if they have any other diseases along with that, maybe for those you can ask modalities. If there are no specific modalities, don't press, just move on to the next point. Then it is not, if there are no specific modalities, it means that it is not relevant to your case then. Next question. Ma'am, please tell how to collect mental symptoms. Very good question. Easy to study about, difficult to practice in the clinic. So mental symptoms, you can never tell the patient directly to their face that भाई मैं आपकी अभी mentals लेने वाली हूँ तो या लेने वाला हूँ तो बताओ आपके बारे में. They will not like it. They will find it very suspicious. They'll say, why is this person asking me all these personal questions? So in that situation, the best thing is to do for you is to make sure that you're giving your undivided attention to the patient, that they are, they feel comfortable in your presence, and they know that they can trust you to tell all their inner feelings, their all their discomforts. So what you should do is you start asking about them by saying that, tell me about yourself, and can you describe yourself in short. The moment you say short, I'm sure they will take longer to talk about themselves. They'll never keep it short. So just build a confidence in the patient slowly, make it like a conversation, and keep them comfortable. Maintain eye contact. Don't keep on scribbling, small things they tell you. They'll think that you're more interested in writing than listening to them. So at that time, small things in your body language will make a lot of difference. So keep your pen down, look at them in the face, in the eye, and ask them more about themselves, where they were born, how they, who all are there in their family, and keep listening. As they are listening, keep observing, and there are small details that you might note as they are talking. Mental symptoms are not easy to get hold of in the first case, but at the same time, you can get a general picture. And right from the time the patient walks into your clinic, there are signs about them that you should observe that might give you an indication to what remedy that you can choose. Does every case require a constitutional remedy? Not necessary. Not necessary, because there are many acute cases, like she said, genus epidemicus, or acute cases where you just have to deal with the presenting complaint. So in those cases, you don't have to worry about constitutional remedy. The patient is only seeking to relieve the complaint that they have come to you with. For example, if they have eaten pav bhaji or pani puri the previous day and they have a stomach upset, or if they've gone in the AC from the AC to the cold, to the hot air outside, and they've got a cold and sinus. At that particular moment, just give them a remedy where these modalities are very typical. For example, from cold room to hot room or hot room to cold room, all these modalities are present only one or two remedies. So then you can choose that remedy and you can bring about some relief. Okay. We usually find symptoms in location, sensation, modality, and concomitant. I really find it difficult to find concomitant symptoms. Please tell. See, you don't have to record it so specifically. Concomitants, if they are present, then you can record it. If they are not, don't bother about it. Most of the time, location, sensation, and modality itself will give you a clear picture. Sometimes concomitants, the patient might bring it up later, say that, oh, doctor, I remember this also happens when I have my periods. I also start craving for ice cream, something like that, which is specific only to that complaint. That is when you have to make a note. Again, you have to pay attention and you have to make a note of it. What's the next? Is mental symptom essential in every case? Yeah, why not? I mean, sometimes if you want to choose a constitutional remedy, mental symptoms are important. But again, when it is an acute case with only one or two symptoms, maybe you don't have to worry about mental symptoms. But if you are taking a detailed case, it's good to have the mentals, because many times it gives you a clearer picture of the patient's constitution. It comes with practice. You cannot take the mental case of the patient immediately with the very first patient that you meet. Keep practicing, work on your conversation, work on your skills. That is why it is the art of case taking. It's not just a science. So it's good if you can take mental symptoms. If you can't, if you're finding it difficult, leave it, because if it becomes uncomfortable for you, even the patient becomes uncomfortable. So just focus on the presenting complaints then. Next question. What should you prefer in case taking? Physical symptoms or mental symptoms? Sujata, why did you answer this? I've been answering. What should you prefer in case taking? Physical
Both,
symptoms or mental symptoms?
both, मैम both जो भी होगा
Both.
applicable होगा उस केस के लिए both.
Both.
उस
But
केस
why?
के लिए जो भी like some cases we only get the physical symptoms या फिर और कुछ ऐसे cases है जिससे सिर्फ हमें mental symptoms मिलेगी. So according to the case we can take any symptom which is available for us at that particular moment.
Okay. So physical symptoms help you for treating the disease, because that is the presenting complaint that they come to you with. And mental symptoms help you in selecting a constitution. So you have to combine both of them and form a totality. You cannot separate the two. But mentals are important in building a constitution. You cannot separate the two. You can't say ye alag hai or wo alag hai. Both are integral in selecting the remedy. So, but it is up to you to take both the symptoms, both the types of symptoms carefully. Next question. Out of the many symptoms said by the patient, what should we consider in analysis? First of all, what is analysis? Analysis is nothing but going through the entire case and choosing those symptoms which are relevant. So you're presenting complaints, the duration, the nature of the complaint, the sensation, and the modalities. These are important. And you must also consider physical generals. Physical generals are what set the patient apart from the. See, it is the law of individualization. You can have three patients or five patients coming to you with the same physical complaint. But what is it? The physical particulars. But what is it that makes one different from the other? That you choose to give pulsatilla to one and say ignatia to another. It is the physical generals. Physical generals like appetite, thirst, desires, aversions, thermals, sleep. These are what keep the patient and make a patient an individual. So take pay a lot of attention to this and include that in your analysis. And of course, mental generals. General symptoms are what help individualize a patient. Remember that. Particulars are what pertain to the disease itself, the disease symptoms. So consider all of them to form the totality, and that will help you with the analysis. In psychology or psychic cases, in I think psychiatric cases, how to get the mentals. Again, you have to make it sound like a conversation. Just chat with the patient, look them in the eye, make eye contact, keep nodding, be patient, be a good listener, don't interrupt. I think all these points were noted by Sujata. Be a good listener. See, there are two things in BK Sarkar. He has mentioned two things: a non-observer and a mal-observer. So, a non-observer is somebody who misses the symptom completely, whether it is observing the patient's body language, some habits. They might be touching this, or they might, bring their tongue out, or they might keep fidgeting, or they might seem nervous, or something small like that. You'll find a lot of sweat here, or you'll find sweat. They'll keep on wiping it. So, these small things help you choose the remedy, help add to the totality when helps you choose the remedy. So, a non-observer is somebody who misses these small details, small signs in a patient, and they miss out on the totality. They don't add it in the totality. A mal-observer is somebody who misinterprets the symptom. Matlab, they see the symptom, they note it down, but they understand it wrong. So again, that is also not good for the case. So be an observer, be a listener, and try not to make those two mistakes. So in psychology, what happens is you have to let the patient talk. At the same time, do all your observation inside your head. You should not let the patient know that all these thought processes are going on inside. Keep listening to them. And don't ask any leading questions that how do you feel? Does this make you feel in such a way? Instead, you should ask them, how does it make you feel? You should not ask them questions where the answer will only be yes or no. For example, do you feel more afraid when you come in front of a dog, or when you see ghosts? Are you afraid of ghosts? Ask them, what are your fears? Or ask them more generally, like saying, are there any things that make you feel afraid? So don't ask leading questions. And of course, you have to also let the patient talk after that. And don't press, or don't try to probe into the detail of one particular point. If they're not willing, or if they're not comfortable, or not keen on talking of one topic, move on to the next topic. Don't try to probe too much and ask too many details about that point. Next question. When we take the case, for example, the case is pulsatilla, then we given to the patient pulsatilla, it was cured. So the constitution of the patient is pulsatilla. The next time after the same patient comes, can we give again pulsatilla because of his constitution? Yes, you can. Let's say pulsatilla is like a default remedy for that person because it works. What is a constitutional remedy? It's a remedy that works best on such a constitution. It works best on females who are fair, delicate, who have a weeping disposition. But that does not mean that pulsatilla will not work on somebody who is, fat, tall, dark, also the same, or a male for that matter. It's just that its best action is seen on such and such constitution. So sometimes just take the symptoms. You don't have to take the person's constitution, just take the symptoms. If it matches, for example, if they come to you after eating rich and fatty food, or they seem to be thirstless, yes, you can give pulsatilla and still find some sort of a um, difference or some sort of improvement in the patient. So you can give pulsatilla again, no doubt, but sometimes if the symptoms, acute symptoms, or if the presentation points to another remedy, no harm in trying it. There is no rule that you should only keep giving pulsatilla each time. Okay, next question. Why we have to change the medicine on second time if needed, if we have given the similar remedy on the first time? So sometimes symptoms can change. Again, we are dealing with symptoms, totality of symptoms. So if the similimum points to the constitution the first time and it worked, very good. If the second time they come with a new set of symptoms or they come with a new set of complaints, maybe because of some acute exposure or because of some environmental factor, then you can change the remedy. You can give something based only on the symptoms. You don't have to worry about the exact similimum or the constitutional. I hope that answers the question. Next question. Ma'am, how to define a case acute or chronic? Let's say a person is having cold from 3 months. Is that chronic or acute? Please tell relation with time period for defining chronicity. Okay, so there are two things. Okay, a cold, the cause is important. The cause of the disease determines whether it is acute or chronic. Secondly, there is something called an acute exacerbation of a chronic disease. That means there is a tendency for chronicity. A chronic disease will never leave the person fully. The tendency will always be there in the body. But sometimes, because of the environmental aggravation, it can flare up as an acute condition. So you should not mistake that as an acute disease. You should think of it as an acute flare up of that existing chronic disease. So a cold which has been there for 3 months is not just a cold. It's not because of change in weather, or it's not because of the ice cream you had yesterday. It is because of some pre-existing allergy or pre-existing autoimmune condition that you might be having within, and that can be labeled as a chronic disease. An acute cold will not last for more than a week. So you have to determine the cause and the duration. The duration alone is not enough. You have to determine the cause, find out the history, whether they have the cold recurring because of the same set of conditions, or whether it is happening for the first time, or whether it is happening this one time. If they had an ice cream yesterday and came with a cold today, then maybe it's just an acute thing. But suppose they always find a cold getting worse when they go from a cold room to a hot room, then you can think of it as an acute exacerbation of a chronic condition. What is the next question? What is the need of miasms in a case and its approach, ma'am? Okay, so miasms as a topic we are going to deal with separately. It's a very detailed and a very important topic. So I don't want to go into too much of depth as far as miasms are concerned, but I'll just give you a very small answer to that. Miasms help in determining the progress of the disease. See, SORA is the fundamental miasm in all cases, all chronic cases. But when you have something like syphilis or psychosis, these are seen as manifestations from maybe even a previous generation. For example, if your father or his father went through a set of diseases, he has passed on that tendency to you also. So it has been developing over over a long period of time, and it's a very slowly developing miasm. The other two, that is SORA and psychosis. So we have to determine again the cause and the duration, which will help us determine the miasm. And many diseases can be classified, that is, we are talking about clinical diseases itself, that can be classified based on the miasm. So, for example, you know that in psychosis you have a lot of outgrowths, overgrowths. So anything like tonsils, adenoids, tumors, PCOD, uterine fibroids, all these can be classified as psychotic miasm. Whereas ulcers, destruction, degeneration, cancers, all these diseases can be classified as syphilis. So you need to know what the miasmatic approach is, what the miasmatic background is, so that you can select a remedy. And also, you should not mix two remedies. One remedy of syphilitic origin and one remedy of psychotic origin. You cannot mix the two of them because it can lead to something complex and complicated. So we'll deal with miasms in detail in a future session. Today we won't go into too much of depth with miasms. Just bear with us. Okay. Ma'am, sometimes it's really hard to understand what patient is saying and then how to write it down. So if that happens, actually an example would help. If you could give me an example, Ritu. What kind of difficult thing is the patient saying? So when that happens, you can ask them to repeat. If you still cannot understand, change your question, change the way you approach the question. So sometimes patients also like to talk. They like to, keep going round and round on the same topic. At that time, if you feel that it is not relevant or it is not important to your case, just change the topic slowly. Don't abruptly change. Just slowly change the topic or move on to the next thing. I think they will also understand that, maybe they are just beating around the bush. If it is something relevant and if it's really something important, the patient will usually say it, you know, um, in 2, 3 sentences and get done with. Sometimes our case taking skill also has to play a role because we have to make them slowly understand that, they have to stick to the important thing that they have come for, not start giving some history of some past which is not relevant to the treatment. You don't have to write down each and everything, just write down what is most relevant. So that's why we have classified into location, sensation, modality, concomitant. Ma'am, doctor को physician क्यों कहते हैं? Because we also are supposed to do examination, isn't it? It's not only about asking oral questions, it's also about examination. So the old school of doctors, they also physically examine the patient and they make them lie down on the bed. They check them from head to toe. It's also for the patient's satisfaction. Next question. Ma'am, in your treatment is permanent restoration of health. Then why patient gets sick again? I'm sorry, Jalil. I'm not sure I understood the question. If you could just repeat that. Okay, I think what you mean is that in homeopathy we promise permanent restoration of health, so why do patients get sick again? It's not that. It's not exactly a permanent restoration of health. It is about giving comfort and it's about bringing them back to a fully functioning order. But you cannot stop external factors from acting on the patient again and again. So if we can help the person get better with the remedy that we selected, and after that also if they keep going back to that same exciting factor, then the body will react to it. So they should avoid certain exciting factors because that will cause a certain aggravation in them. However, in homeopathy, after a prolonged exposure to homeopathic treatment, the body does get better and better. It gets more and more immune to the condition, and you won't find the frequency so much anymore. For example, if they're catching a cold every month before, maybe now the frequency of the cold will be reduced to 6 months, once a year. But it requires a certain period of time depending on the chronicity of the complaint. It's not possible to treat a chronic disease in just 1 month and not expect it to return. Okay, next question. If patient is having a problem for the very first time, but it is from past 2 to 3 months, they have no personal history or family history for same, is that chronic or acute? Example, if it is urticaria. Okay, so urticaria is again another example of autoimmune disease. Autoimmune diseases don't just get treated or cured overnight. So you can consider it a chronic case. It's not necessary that they have to have a family history or a family background of urticaria. It could be some other skin or respiratory related complaint. Allergies in general are genetic, they do get passed on. So it doesn't have to be the exact same allergy, it can be something similar or it can be something related. And a person who's having it for the past 2 to 3 months is you can't say that it is a chronic case, but you can treat it as something that has existed in the last 2 to 3 months. You don't have to think of it as something that has been that might have been there since childhood or since what do you call for many years. What I'm trying to say is when you choose the potency, you don't have to choose it as a very high potency. You just have to choose it as something that has existed for 2 to 3 months. Because the last class we discussed posology, we were talking about high and low potencies. So at that time, many people asked that, oh, what can be chosen for chronic case or a acute case. So I'm talking based on that. So urticaria being an autoimmune disease can be treated as a chronic case. Okay, ma'am, in conditions such as introvert patients, they don't give us complete picture of the case. In that condition, what do we have to do? Okay, so that itself gives you a picture of the patient, right? There are many constitutions where the patient does not open up, the patient does not feel free to talk. So at that time, you can use the word of the attender if there is one, or you can ask them to return. By then, you have to build the patient's confidence. take only the presenting complaints and tell them, look, you have come with such and such complaint, and I will be happy to help you feel better in at least in that symptom. You don't have to worry about their constitution so much. If the patient wants to, they will return to you. By then, you can get them to open up some more. Build the confidence in the patient so that they open up. How do you build that confidence? By treating the presenting complaints. If the patient sees that you have successfully treated their presenting complaints, the complaints that they have come to you for, then they will feel more confident in you and they will come the second time and they will also open up and they will start talking. It's not possible to get all people to talk everything at the first visit itself. It's quite common. So at that time, focus on the chief complaints. And also, if there is an attender with them, you can even ask the patient to step outside for some time and speak to the attender about the patient and ask them for a few more details. Ma'am, how to deal with patients who don't answer our questions? They're always like, "ठीक है, normal है, and we really want to take case for remedy." So when they tell you it is normal, it means it is normal. There is nothing unique or nothing peculiar about those particular questions that you have asked. For example, if they say appetite is normal, thirst is normal, sleep is normal, perspiration is normal, it means it is normal. There is nothing abnormal about it. So just focus on those complaints that they are trying to talk to you about. It doesn't mean that you have to get everything as abnormal for all the generals and all the questions that you're asking. They probably have only one or two complaints that are standing out. You can just focus on those. I am not a BHMS student, but watching a webinar for. Thank you, Anuj. Nice to know that we have certain non-homeopathic students taking interest. Very nice. Ma'am, can you please share your clinical tips regarding case taking? Okay, and Jalil wants to know, ma'am, give suggestions for second BHMS students as we are at the beginning of this world of homeopathy. Okay, I'll answer both your questions. So clinical tips in case taking is there really is no tip. The only thing is when you start your practice, don't don't show people you are nervous. You will be nervous, but don't show them that you're nervous. There's nothing else to say. The best thing is if you can join a senior doctor and watch the way they handle a patient. They are very easygoing and they're very free. They don't sit down and keep a very serious face and make the patient feel uncomfortable, even if it is a very serious or a very a progressive disease. They never let the patient know. Like for example, Sujata said, don't get emotionally involved with the patient. What she means is, if they are upset, don't start crying with them. Or sometimes patients can test your patience by asking silly questions, or they will ask you something personal in return. So don't show your anger, don't get impatient. Just be very neutral, and you have to let the case flow easily. You can't have any awkward pauses. So all these things develop over a period of time. It does not happen with the first case you take. I can give you a few examples. I myself had when I was an intern, the first couple of cases I took, I really didn't know what to ask the patient. And one patient, she was lying asleep on the bed, so I had to ask her son. It was so odd. I couldn't ask her obstetric and gynec history to her son, a grown-up son. He must have been around 25, 26. So I just asked the chief complaints, and I made the mistake of keeping a very serious and a very sober face. So I think he got scared thinking that his mother is having something serious. So then I realized my mistake later. So you need to take at least 10, 20, 30 cases to improve on your skills, but don't lose heart. It builds up your confidence. That is why our work is called practice. It's not called perfect. So with practice, with every patient, we get better and better. So keep the conversation going. And as you're writing the symptoms down, keep looking at the patient up. Don't keep on just focusing on your writing. They want you to also pay attention to their selves, to their personal selves. So keep looking up at them, make eye contact, and try to talk the patient's language. I don't mean that if it's a Tamil patient, talk in Tamil, or if they are Gujarati, talk in Gujarati. What I mean is, if he's a businessman, talk a little bit about business. If he's a student, talk to him about his studies. So, what do you do? And try to keep up with current affairs, current trends. Read up about general knowledge, about news on Google. Today, with Google, life is very easy. You can just search anything So keep up on all these topics so that you can converse. Doctors only ask in return. Second, BHMS, you still have a long way to go, and you'll learn on your mistakes. Don't miss those. When you're in the clinics, make a lot of mistakes. Best ways to learn from your mistakes. Don't be afraid of mistakes because if everybody knows you're a student, they will be patient with you and they will help you solve all those problems. And keep reading your books. Keep reading your materia medica. Share it with your friends, discuss it with your friends. Sometimes quiz each other on your materia medica. Your knowledge of materia medica has to be thorough. There is no excuse for that. How to go through these philosophy of Kent, Roberts, and all, they're really difficult to understand from language point of view. Yes, I agree with you. All those authors had written these books 250 years back, so their English is very formal and their English is very old fashioned. Even we struggled a lot. But today, with Google and today with smartphones, you can always Google the meanings of many of these words. Write your own notes. Don't get afraid. See, at least from the exam point of view, you need to write something right to the point. You don't have to write your own essays. You don't have to write your own book. So write down your own notes in a simpler language. Google the meanings and note it down. You don't have to repeat the exact same word that the author has written. Write the meaning of the word. It doesn't matter. You don't have to write sanguine temperament if you can't remember the word. Just write hopeful or friendly. That's also enough. So try to make your own notes and try to create your own charts and flow charts so that it's easy for you to remember. So Herbert Roberts writes in a very nice way. His language is quite simple. So you could follow his books more. Stuart Close is a little deeper and a little bit more elaborate. So read it only for a few points, like the 2 mark. Do you people still have 2 mark questions? Sujata, do you still have 2 mark questions? Can someone answer that? Yeah? Okay. So if your questions, those small 2 mark questions usually come with notes from Stuart Close. So maybe a few of those things that are written in italics, maybe those you could note down and read them up. It's not too difficult if you're able to understand the meaning behind the theory. You can write it down in your own language, in your own words, with your own understanding. You don't have to repeat the exact words of what you've written. And of course, you can contact us if there are any queries, any doubts. Okay, Anuj Mishra. Actually, Dadaji was a homeopathic physician. I used to go with him to his clinic. Can take admission in BHMS after my graduation. Good luck with it, Anuj. We look forward to hearing from you and seeing you as a homeopathic physician in the future. Ma'am, how to find out the thermals if patient doesn't know about this, whether he's chilly or hot? So if he doesn't know whether he's chilly or hot, ask him, are you more comfortable in a cold environment or a warm environment? Many of them just say, ma'am, normal, I'm normal, not too cold, not too hot. Leave it at that. Don't probe any further. Don't ask too much in depth, saying आपको आइसक्रीम पसंद है क्या आपको एसी पसंद है या आपको गर्मी में कैसे लगता है. Don't ask all that because if he's not answering specifically, it means it's not a very specific modality for him. So there is no need to probe and find out. You cannot select the remedy based only on one symptom. It's only a guiding factor. Can you please make another session regarding miasms? Yes, definitely. I think we might have to have 2 or 3 sessions on miasms because we might have to deal with each miasm separately. Yes, you have 2 mark questions or 1 mark. Okay, so 1 mark or 2 mark questions. What happens is at that time you can make small notes from Stuart Close. He has points like a priori or some other no points which he writes in those italics. So for that you have to read from Stuart Close, make the notes. It's not difficult. Just understand it's 2 or 3 sentences. Try to understand that, and you can write that in these answers. But otherwise, from a practical point of view or from a consultation point of view, these things do not really come to your mind. You just have to go with the flow, work on your conversation skills. See, doctors usually, when you go to a clinic, you look at the doctor too, right? Even you observe the doctor. It's not just the physician who's observing you. So at that time, what you should do is you should just be confident, win the patient's trust, chat with them, and make it sound like a conversation. It should not feel like an interrogation. You're not in the police lockup where, the policeman is asking you question after question. Keep it comfortable, keep it pleasant. And if you yourself don't know what to ask next, just move on to the next question. It'll come to you at some point. I think there are some more question and answers, no? Why do we have to change the medicine on second time if needed? We are given. Okay, I think I answered that in the other chat box. Any other questions? Anything else that you would like to get cleared out? Case taking is a very easy topic to study from an exam point of view, but it's not easy to start practicing from, a physician's point of view. But don't lose heart. It comes with practice and work on it. Like start practicing on your friends, your relatives, start taking their case and see how it feels. And if they're not able to answer or if they start laughing at you, don't lose heart, don't get nervous. Just keep a straight face and say, yes, this helps. Everything you answer, everything you tell me helps me choose the best remedy to treat you. Say that is what is special about homeopathy. You have one remedy to treat many diseases, and you have many remedies that can treat one disease. Tell your patients that. Thank you so much, ma'am. Really helpful webinar. Thanks for answering all the questions. Yeah, it's my pleasure. I hope I've answered most of your questions correctly. How to present 15-mark questions? I think some student should answer that, no? Okay. Ma'am, what about desires and aversions? But in art materia medica, particular drug gives desires. But the patient says by the start of disease, he or she develops desires, then we have to consider it for giving the remedy, ma'am. Okay. So again, make it very general. You don't have to ask very specifically, do you like bread or do you like acids? Do you like achar? Don't ask like that. Just come to it when you start your physical generals. Just tell the patient, I need to know a few personal details about you. And normally, patients feel comfortable opening up to the doctor. Only people who have problems, who are trouble, come to the doctor. Normal or regular people will not come. So they can expect you to ask them certain personal questions or certain personal details. Tell them that I want to ask a few personal details about you. So start with diet, thirst, bowels and bladder. Then say are there any particular foods or any particular tastes you are very fond of? If they don't understand what you mean, just prompt them. Give them a little bit of a hint by saying sweet, sour, spicy, salty. Again, that is also gentle. You're not specifying the dish or you're not specifying any particular item that might be an aversion or a desire. If they say no, there's nothing, doctor, nothing. I like everything. I eat everything. Leave it at that. Don't keep probing again and saying no, but there has to be something you don't like. There has to be something that you like. Don't use the word desire or crave. Just say, is there anything that you like a lot or you feel like having repeatedly? So the word desire or aversion is more for your reference. The patient may not understand when you say, is there anything that you desire? And sometimes if there is nothing both specific in desire and aversion, leave it because it is not present or it is not prominent in that case. It won't even be of any use to you while analyzing and evaluating the case. How to judge a patient that is hypochondriac or really he has that much pain? A patient with actual pain and actual discomfort, it will be visible on them, especially if it is something very acute. If they have developed high fever or if they're having severe abdominal pain or if they're having a heavy cold, you can see it in them. You don't even have to ask them. A hypochondriac, may have a tendency to keep returning to you again and again. And you can tell that, it's not a very serious complaint. It is not a very specific thing. They probably just feel a certain anxiety towards that particular complaint. I can give an example. I had a patient, husband and wife. They're both quite old. I think they were 65, 70 years old. And the husband had leukemia, a history of leukemia many years back, but it was under control. He didn't have any symptoms or he didn't test for anything positive at that moment. He probably was under remission when he had come to me. He used to come with small bites like a mosquito bite here or a small boil over here, and he'll say, "Doctor, this has come today. Is this cancer? Is this cancer?" So maybe his history of leukemia made him paranoid. Maybe it made him anxious. But I could look at him and I could say that it's not cancer. I knew it was only a mosquito bite. So in such cases, you have to reassure them, and then after some time say, "Sir, please, you can carry on." If they still insist, give them a small remedy, like say, couple of doses of Rustox or Arnica. Just an example, couple of doses of Rustox or Arnica, and say that you'll be fine. He will be fine, even if you're not given a medicine. He will be fine. But for the patient's satisfaction, a couple of doses of medicine, at least he feels that you're taking care of him. A hypochondriac usually returns with the same complaint, but you will find that there is no, what you say, no intense discomfort or no degeneration in that particular patient. So it is up to you to observe and decide whether it is really a severe case or whether it is just oversensitivity, or they're just having that fear or paranoia of something worse developing. What else? Any other questions? The best way to discuss case taking is by using examples, and the more mistakes you make, the better you'll get. It's okay. It's all right to make mistakes. You're not going to harm anybody. You're not going to harm yourself also. And when you start your practice, usually you do it with less intense and less severe cases. People normally come to a new doctor with less severe cases. So you don't have to worry about, oh, if I don't treat them properly, they'll die tomorrow. You don't have to worry about that. Normally, when they come to you, they come with lesser complaints. They usually would choose, the patient itself will choose a more experienced and senior doctor for more intense and more severe cases. So when you start your practice, you can expect people to come to you for allergies, for colds and coughs, stomach upsets, for pediatric complaints. These are easier to handle, and you can take the case without much difficulty. As time progresses, then you'll find that there are people coming with more intense complaints. By then, you'll feel more confident in taking the case. Don't lose heart. Again, don't feel nervous. Give something for the immediate relief of the patient and ask them to come back to you within a week. Most patients feel happy to come back to you, and at that time, by then you can analyze the case and you can, come up with a constitutional remedy. It comes with practice. What about Saclac, ma'am? Saclac is good. I mean, it's for the patient's satisfaction. Give it with the constitutional remedy or give it with the actual similarium that you've chosen. It at least makes them feel satisfied, because many times they'll say, "You only asked me to take 2 pills. Can I take 4 instead?" So then how do you explain? You don't want to go into the details. So tell them, all right, take it, no problem. The truth is, if they take 1 pill or they take the whole bottle, the effect is the same, because it is the potency that we are concerned with. It is not the quantity of the medicine, it is the quality of the medicine. So you can give Saclac, no harm in it. It's never going to hurt anybody. It's just a way of satisfying the patient and making them think that they're taking several medicines. So at least they feel comforted. It's just a way of, promoting our system of homeopathy and making it seem like a good and reliable system. Thank you so much. This session really helped us. Very happy, Smaranjiti. I hope to see you again for the future sessions. Are there any more questions? Any more doubts to be cleared? Anything else that you'd like discussed? Any other point that you think has been missed out? Sujata? Sujata, can you hear? Sujata? I think Sujata's video is hanging. Okay. So there is one question here on fundamental cause by Ritu. I just want to, I will address that, just make a note. I will address that when we are discussing myasm, because then it will go into those details. Okay, how can we get in touch with you in the future? Okay, so whichever link or whichever person shared the link with you, you can ask them for my contact. Right now, I don't want to share it here. It's usually through this portal, through this webinar that I come in touch. But I will be present for every future webinar. So you can always ask me any doubts then. I'll provide my contact details through that. What is the next webinar topic? Why doesn't somebody suggest the topic? Because we are all, whatever discussion we are having, we are all demands you have, we like to honor those demands. So any particular topic, any popular demand for the topic. We have covered organon, the basics of organon. We have covered posology. We have covered art of case taking. What shall we do next? Come on, you people have to come with the topic. Anybody, or shall we select it ourselves? Any suggestions? Classification of disease. Okay. Drug proving. Drug proving is, there's not much to explain in drug proving. It's just that you have to know and you have to remember a lot of points in the procedure. So I mean, we can deal with the symptomatology. Miasms, yeah, miasms is a very important and very detailed topic. So let us do a few more simpler ones before we move to miasms. So miasms, we'll have to do one class on just miasms, and then we'll have to do 3 classes on the 3 different miasms. Then we'll have to deal with each one separately. We'll deal with that in the future, but in detail. Is drug proving okay? Does everybody want to do drug proving? So someone wants to reply, we can lock down on that topic. Vital force and miasm, we'll do it in the future. We'll not do it in the next class, but we will deal with it in detail. Shall we take up drug proving for the next class? Yes? Otherwise, we'll announce the next class when we are announcing the topic. We'll let you know. We'll decide amongst ourselves and we'll let you know. We'll confirm the topic. So is that all? Shall we call it a day? Or are there any doubts left? Okay, I think no doubts. Hopefully, I've cleared at least a few of them, and you've been able to pick up a few points on Scope of Homeopathy by Roberts. Somebody's favorite author seems to be Roberts. Intermittent diseases. Okay. Yeah, I'll tell you what. Let us just discuss, and we'll how to do or remember or study medicines. That is a separate topic. I don't think I can answer it as a doubt here. We might have to have a separate class on that. I'll make a note of that. Okay, so we'll let you know what the topic is for the next class. We'll just discuss amongst ourselves. Till then, let's close down today's discussion and hope you all had a good session. We look forward to receiving you people for the next class next week, same time. And if we can announce the topic a little in advance, maybe some of you can come a little more prepared on it to ask a few more doubts. And thank you for having us. Thank you for attending. And I'll call it a day. Susceptibility. Okay. Susceptibility was discussed last class on when we were doing posology. So that was dealt with. Maybe you can, check the recording because we spoke a lot on susceptibility in that class. It comes under posology and choosing the. So maybe you can access the recording of the previous class. We've discussed a lot on susceptibility. All right. Thank you so much. Good night to all of you. I'm going to close the session now. So see you all next week.